The thing that makes health advice so boring is the things that grandma told us. And it's not sexy and it puts people to sleep, but it's true. Welcome back to the Pod Digest. Dr. Mike emphasizes his mission to counter the overwhelming presence of health misinformation online, particularly in areas where scientific understanding remains incomplete, also called the gray zone. Most doctors that do really well on social media either leave medicine or maybe do concierge practice or celebrity practice. The intention may be good, and good intentions can have bad outcomes, but if the information is not accurate, no matter how passionate you are about the subject long term, it's going to have negative outcomes. Dr. Mike works at a community health center where 50% of people don't have insurance, and social media is just a tool to help him with that goal. Doctors are probably the biggest hypocrites when it comes to their own health. Some people will have talks about sleep or health, but still struggle with sleep. They don't do those things, just like how Dr. Mike himself cannot follow his own advice to the T. His job is just to present the evidence. So there are certain things that we should be doing better, but just because we know doesn't mean that we will be following it 100% all the time. Dr. Mike reflects on the loss of his mother to cancer and how this profoundly shaped his outlook on life and medicine. He discusses the importance of mental health, coping with grief, and finding healthy outlets for stress. We have this stigma where if you go for mental health treatment, you're somehow weak. But if you go for treatment for a broken bone, you're not weak. That stigma doesn't exist. Both things can have problems arise with it, especially from a mental health standpoint. With the society we find ourselves in currently, society is the most unnatural it's ever been for humans. With his significant online presence, there is tremendous pressure and anxiety. The addictive nature of social media and negative feedback impacted his mental health. And when you get to that point, you're never letting your mind rest. This state of being in fight or flight does not let you rest, repair, or get good quality sleep. The important thing here is to set boundaries and prioritizing well-being by limiting exposure to social media. Dr. Mike emphasizes the need for mindful usage, focusing on community building and learning rather than passive consumption. We're being out-edged by people who are trying to make a profit in the healthcare space. Longevity and anti-aging, live forever culture are things that have emerged in the last couple of years. So when we talk about health insurance, the pharma industry, anti-aging industry, a lot of it has been corrupted with capitalism. Right now on social media, we only see a lot of people just supporting what agrees with them. 30 years ago, the grey zone was weight loss. People used to sell you nonsense to try and help you lose weight. Even if it made you lose weight, it was in an unhealthy way. Then came some medications like Ozempic, and people started actually losing weight with an FDA-approved medicine that had real results. When it comes to exercise and weight loss, let's just take a very simple example. You go to the movies and eat a tub of popcorn, a little candy bar, and a soda that is all over 1,000 calories. Most of us are not physically even equipped to burn 1,000 calories during an exercise session. General guidelines for exercise say 150 minutes of moderate intensity exercise per week. A simple way to put it is you shouldn't be able to speak full sentences, maybe one sentence at a time until you're out of breath. When it comes to dieting, зрение, какое влияние оно оказывает на ваш вес? Because calories in and calories out is as sexy as it sounds. Second, you also need to think about the nutrients in your food, because if we just take one of those parts and ignore the other, that is not doing much. If you just eat loads of salads, you might be in a calorie deficit situation. If you're overeating calories, you can get into a metabolic problem where now you're carrying excess weight and increasing your risks of all sorts of conditions. So the goal is to get you in a place where it's balanced in both a caloric weight management standpoint, but also in ideally a healthy nutritional balance as well. Even though exercise offers numerous health benefits, including improved mood, cardiovascular health, and cancer risk reduction, it is challenging to out-exercise a poor diet. Individuals should prioritize making sustainable dietary changes that address both caloric intake and nutritional balance. Someone quotes a research saying, "We need to move closer to a plant-focused diet to boost your immune system and hyper-optimize this." It doesn't mean that everyone needs to be on it. Hyper-optimization is extreme. Going into those extremes You start creating problems for the human body. It works in homeostasis. It wants to be balanced. You should aim to be good, not perfect when it comes to healthcare. So perfect is not only just an illusion, it's a toxic illusion. Dr. Mike expresses skepticism about the effectiveness of most supplements, arguing that they are often unnecessary, poorly regulated, financially burdensome, and potentially harmful. He emphasizes the importance of obtaining nutrients through a balanced diet. Most supplements are unnecessary unless you have a specific medical condition. They can distract people from healthy habits, are expensive, and may have side effects and interactions with medications. They are marketed by capitalizing on people's insecurities and desire for shortcuts. The potential risks associated with supplements include side effects, interactions with medications, and the lack of regulation by the Food and Drug Administration, FDA. There is variability in supplement quality and the potential for harmful ingredients or inaccurate labeling. The most worrisome thing is when we enter the space of people saying they need supplements and not true medical treatments for conditions that bother or affect them. Antioxidants are generally healthy. B vitamins are traditionally labeled as healthy. If you have too many of them, they become pro-inflammatory. But no one talks about that because then the pharma companies can't sell that. So what instead gets talked about is the promise of what they could do. Dr. Mike acknowledges the emerging understanding of the gut microbiome and its connection to overall health, the counts by which they exist, and people who generally eat specific foods that are rich in them may have better health outcomes than those who don't. While there's truth in the interconnectedness between gut health and overall health, manipulating the microbiome with prebiotics and probiotics has not been proven effective in most cases. Do we know that taking a prebiotic supplement does the same? We don't know. Do we know that having specific bacteria in the gut gets destroyed if you have a health condition? We do know that. But does that mean re-establishing it by taking it in a pill will fix that condition? We don't know that, but people will make that jump and say, it's no big deal. They might be genuinely trying to help, but it's a big deal because we're promising something that we're uncertain of without even some good evidence for it. There's very few conditions that probiotics can actually help with. A good way forward would be focusing on foods that are considered healthy for the microbiome. Dr. Mike addresses the misconception that vaping is harmless. He acknowledges that while vaping may be less harmful than traditional cigarettes, it still poses significant health risks, particularly for young people whose developing brains are more susceptible to addiction. He emphasizes the dangers associated with nicotine addiction and the potential for vaping to serve as a gateway to smoking. He advises against using vaping as an introductory step to nicotine and encourages individuals to utilize it only as a tool for quitting smoking under the guidance of healthcare professionals. There is erosion of trust in the healthcare system due to misinformation, sensationalized media reporting, the influence of social media, and the perceived conflicts of interest within the pharmaceutical industry. For example, we've created this world of processed foods, unhealthy foods, foods that cause us to eat more and more and feel not satiated. Then we come up with a medication to solve that. We've created apps that pull our attention spans, that allow us to focus 10, 15 seconds at a time before we swipe to the next thing. Much of the counter movement we're seeing now is because we believe pharma is corrupt, and they're meddling with doctors to get drugs into the market that maybe don't work. The reason why birth control may be being brought up is because this is a topic people are very passionate about. This is a topic where doctors have discriminated in the past about, so it's a bit more triggering to the emotional part of our brains. But if we look at what's leading hospitalizations from a drug in the United States, it is Tylenol. No one is making an uproar on YouTube videos that Tylenol is problematic because it's not emotionally triggering. The amount of hospitalizations for Tylenol-induced liver failure is sky high. The need for transparency and accountability is needed within the healthcare industry to rebuild trust. While instances of medical error and misconduct do occur, they are not representative of the entire medical profession. Doctors are also human, subject to error and limitations, and that the pursuit of perfect healthcare is an ongoing process. Thanks a lot for watching. Please don't forget to like and subscribe to our channel.